Good morning, good evening, good afternoon. Welcome to this second session of the webinar series, Our Homes, Our Health, Advancing an Inclusive Agenda for Building Performance. The theme for this session is Global Health and Resilient Housing. My name is Rebecca Ochong, and I'm the Senior Manager, Urban Land and Housing Policy for the Asia Pacific region at Habitat for Humanity International. My co-moderator today is Dr. Esther Obonyo, the Director of the Global Building Network, a partnership between the United Nations Economic Commission for Europe and Penn State University. She's also an Associate Professor of Engineering Design and Architectural Engineering at Penn State University. Now, as we know, the COVID-19 pandemic continues to impact lives, communities, and economies globally. It is also exposing how social injustice and inequality is manifesting itself in the housing sector. Also, in light of multiple disasters such as earthquakes, violent storms, conflicts, forced migration, and global health crises such as the ongoing COVID-19 pandemic, we continue to see that the poor and the most vulnerable are often most impacted negatively. This is because they are more likely to live in homes that are more susceptible to impacts of disaster. We therefore, in this session, seek to catalyze change through facilitating conversations that explore potential strategies that can be used to enhance our health, well-being, and safety at home. Now, let me take this opportunity to recognize and thank our two chatroom moderators, Dr. Masibo Lumala, who is a visiting scholar at Purdue University and a professor at Moi University in Kenya, and Enid Madarkos, the Urban Policy Manager for the Asia Pacific region at Habitat for Humanity International. I also wish to recognize and thank Dr. Elizabeth Stacey of Penn State University, who is our host for the webinar, Angeli Alba of Habitat for Humanity International for communication support, Dr. Junki Zhao from Penn State University also for tech support, communication students from Purdue University for developing the brochure for this webinar. Now, please note that during this webinar, other than the panelists and moderators, everyone else is muted and videos will be off. But for interaction purposes with the panelists, we encourage participants to post questions and share their thoughts through the chat room and Q&A tab. Now, without much further ado, let me hand over to Esther to introduce our panelists. Over to you, Esther.
Thank you, Rebecca. Good morning, good afternoon, good evening. Our summer webinar series is pointed towards promoting a more inclusive building performance agenda, and we seek to accomplish this through facilitating interactions across different disciplines and geographies. Our distinguished panel of speakers exemplifies our commitment to promoting diversity, equity, and inclusion within the building performance discourse. Please join me in welcoming our first speaker, Professor Stacey Connaughton. She's the director of Purdue University's Institute for Policy Research. She's also an associate professor at the Brian Lamb School of Communication. Her research examines leadership and identification in geographically distributed contexts, particularly as these issues relate to virtual teams and organizations, political parties, as well as peace building. Stacey is also the director of Purdue University's Peace Project. This is an externally funded initiative that seeks to reduce the likelihood of political violence in West Africa. Ladies and gentlemen, it's with great pleasure that I hand over to Dr. Stacey Connaughton. Welcome, Stacey.
Thank you very, very much, Esther. Hopefully very soon here we will. Good afternoon, good morning, good evening, everyone. When I was a graduate student at the University of Texas at Austin, Professor Rod Hart invited me to read Murray Edelman's book, Constructing the Political Spectacle. At the time, I was studying how political parties in the United States court Latino voters during elections, and they were spending lots of money to craft those messages to win Latinos' votes. Your vote matters. You matter. Join us, those messages would say. However, as I journeyed from Austin to the US-Mexico border and to many Latino neighborhoods across Texas, I saw an impoverished material economic reality. In my mind, it was a world and a people that outside of political elections had been forgotten. Murray Elliman's book still is one of the most influential books in my life. It reminds me that whether we are talking about Latinos and politics or the world's most vulnerable people and health and housing, we often give them rhetoric, but do we give them policy? COVID-19 has prompted me to think about this question yet again. COVID-19 has made even more visible the world's housing inequities tied to race, gender, and class. It has reminded us that a house is more than just walls and the materials used to build it. It has reminded us that safe and secure housing is and should be considered a human right. COVID-19 has also reminded us of the intricate relationship between science and humanity. And in the United States, COVID-19 has given us an opening to think about the fact that as a nation, we have allowed systemic racism and oppression to continue. It exists in and is perpetuated through discourse, and it is enabled through policy or lack thereof. For me, as a scholar practitioner, COVID-19 has raised questions related to communication and to housing. This crisis has shown that rhetoric and policy in housing design are not always working together. The physical design of housing in many parts of the world and the economic realities that accompany it, to me, is sometimes at odds with some public health messaging. Take the message, for example, stay home. Well, here is what home looks like for some. Staying home makes some human beings even more susceptible to risks, danger, and violence. We are also told oftentimes to social distance. In the United States, that means that we must stay 6 feet apart. For many around the world and in the United States, 6 feet apart is not practical, nor is it an imagined reality. So what happens? We don't social distance. A public health message is one thing, but sometimes people's behaviors are another. And those behaviors are influenced by all sorts of other messages, policies, and lived realities. As we know, the message, wear a face mask, is not simply uttered and then people do it. Some do and some don't. Why is that? Well, for some in the United States, it might be because a certain president decides he does not need to, and some people admit to following his lead. The pandemic requires people to change and to be resilient, but people's circumstances do not always make it possible for change. How can we expect communities, people, to do what we ask, to be resilient, when we have not equipped them or backed them up with policy? When instead, some have been marginalized from policy or targeted and victimized by policy all of their lives. So what can we do? What must we do? In his I Have a Dream speech, Dr. Martin Luther King Jr. hails the urgency of now. The urgency of now. Ironically, 2 years before the killing of George Floyd in Minneapolis, Minnesotan Tina Burnside hailed those very words from Dr. King to call for systemic change. She wrote in 2018 these words that you see before you. Our community, city, and state face serious problems of poverty, racial inequality, and economic disparity. Minnesota ranks as the second worst state for racial inequality for Black people, with glaring disparities in which Blacks are incarcerated at higher numbers, have lower incomes, higher unemployment, and lower home ownership than whites. We can no longer take the luxury of cooling off to study problems. We already know there is a problem. What we need are real solutions. Policy must be crafted in partnership with business, government, and the community. This partnership must include Black voices and leadership. Practitioners, researchers, everyday citizens, what can we do? What must we do? Well, we might go back to the ABCs. In this case, ask questions, be bold, courageously act. In fact, to build resilience at multiple levels, we ourselves must be resilient. We can begin by listening and incorporating the voices of those most affected, the housing insecure. When we listen, I have a hunch we will hear them talking about issues like structure, culture, and discourse, all of which are influencing policy, and who that policy works for, who it does not. So we must, as academics, practitioners, policymakers, and everyday citizens, attend to the relationships between structures, cultures, and discourses. We then must collect the data. We can do so via the lens of engineering, of social science, from the perspectives of the humanities and the methodologies of the sciences, but we must be inclusive of what we consider data. Numbers are great, but do not exclude people's stories. As my colleague and friend Kiran Sinj of the International Storytelling Center would tell us, stories depict people's truths. They reflect their lived experiences, they have much to teach us, and they must not be ignored. Pave the way for young people to lead. I am fortunate to be at a university. I'm thankful for that every day, and I'm surrounded by creative, innovative, inspiring young people who are still open to possibility. They ask why, and they often ask, why not? COVID-19, George Floyd, and Rayshon Brooks have inspired in many of them a desire to be part of positive change and to lead. We need to not stand in their way. Seize this moment. All over the world, recent events have inspired us to connect and to act. Some of that is being done in person, as you see in these photos. Some of that is being done via social media. Let us lead and connect with each other with the urgency of now. Let us also work together to give them policy, or better yet, to co-construct policy together and persuade those who can enact it to do so. In the aftermath of George Floyd's killing, President Barack Obama reminded every American that change often begins at the local community level. One of the reasons I admire Habitat for Humanity is that they live that philosophy every day. One family, one house, one home at a time. Let us ask ourselves, what does locally led policy look like? And how can we make it inclusive of those voices who are most affected? Allow me to conclude my remarks today by bringing it back to my home, Purdue University in West Lafayette, Indiana. In mid-August, we will welcome many of our 44,551 students back to campus. I say many because sadly, some US executive orders and policy decisions may prevent some of them from returning. Our university leadership is encouraging us to practice what we're calling resilient pedagogy. And we're working together to try to figure out how we can do that. Just like any kind of resilience, to make resilient pedagogy and the students' return to campus possible, we're in the process of undergoing a massive cultural change with a communication campaign designed to induce positive behavior, requiring all people on Purdue's campus to wear masks. As you see in these photos, our dorms are being re-engineered as we speak. Public spaces being adjusted to help keep us safe. We're fortunate, for we have the resources to do that. But what about people in places who do not? As we reflect on COVID-19, let us ask the tough questions, be bold in our design and courageous in our action. Practitioners, academics, everyday citizens, policymakers, we must act together and we must not give up. Thank you very much.
Thank you, Stacey. Thank you very much for that wonderful presentation. I'm going to move on now and invite Professor Collins Airhihenbuwa. Collins is the lead for the Global Research Against Non-Communicable Diseases at Georgia State University. He is also a professor of health policy and behavioral sciences within the School of Public Health. Collins is a global expert on health behavior and a pioneer in centralizing culture in health behaviors. He has led several research collaborations, institutional partnerships, and he's also mentored several faculty members and professionals at various institutions across the globe. He is a consultant to several UN agencies, including the World Health Organization, UNFPA, as well as the UN AIDS. He's co-authored over 140 publications, including the book, Healing Our Differences, The Crisis of Global Health and the Politics of Identity, and it was published in 2007. Collins used to be at Penn State University. He was the department chair for biobehavioral health. During his tenure at Penn State, Collins led one of the best global engagement network efforts that Penn State University keeps referring to up to today as a model on how to engage with different teams across the globe. It's with great pleasure that I hand over the floor to Collins Airhihenbuwa. Professor Airhihenbuwa, welcome.
Thank you, Professor Obonyo, and good morning, good afternoon, and good evening to different viewers from around the world. My interest and engagement with this network, of course, started with a conversation with Dr. Obonyo. And as she explained to our speakers 2 days ago, and you just heard that I was at Penn State, and I led and created and directed the Global Health Network that involves several universities, including institutions in Cape Town in Germany, Freiburg in Germany, Pune in India, as two examples. We also had New York University, University of Minnesota as a partner in that network. When we had our inaugural meeting in 2014, which I hosted, we decided unanimously to frame our vision for global health by focusing on two priorities for research, teaching, and engagement. And the priorities were driven by the interest in interdisciplinary and multisectorial work. And these two priorities were, number one, to not only think of condition as communicable or chronic or not communicable, but to think of the intersection of both communicable and non-communicable disease. And the second priority was that we need to focus on urbanization and the way in which it creates different sets of challenges that cut across different sectors, both for those who have to live wherever they are and find themselves in this typically deplorable condition that we see in mega cities across the globe. So my comments and observations today are based on what I consider the three-legged stool that represent the cultural anchor of my African ways of knowing. Each leg of this stool may change depending on whom my audience is, but the key message is to do one thing, and that is to question the question. There are many questions posed in ways that the answer is inevitable. Rather focusing on the answer, I prefer to focus on the question. So to answer what is meant by home and global health, I offer lessons that help to anchor each of the three legs of the stool, which I want to sit on for our conversation. The first leg is represented in the African expression that says, "Until the lion produce their own historians, the story of the hunt will glorify always the hunters." So we have to be thinking about who are the new historians. And the second leg of this stool comes from the work of the late Chinua Achebe, who posed the question is, make the wise caution that you should not enter your home through somebody else's gate. In fact, the direct quote is, "No man should enter his home through another man's gate." So the question is, what is your gate? And would you recognize it when you see it? And the third leg is what has come to be a sort of a mantra in my work, and that is, do you know who you are without what you do? Many people talk about who they are as though they cease to be somebody when that job ends. Do you know who you are when you are not a professor, a director, or a president of something? So new historians of the first leg, I believe that culture is central to global health architecture, and that our global health architecture continues to be restructured and reframed in the language of colonization and colonialism. I also believe that, as I wrote in a recent blog, that racism is global, and that the political architecture of colonialism was structural racism. And let me repeat, that the political architecture of colonialism was structural racism. Therefore, homes, as we have them in the global South, make sense only when you understand the racism that frame its structure as houses. Houses of learning, where African languages were devalued, and houses of caring, where centralized institutions were privileged over community-based care, are two examples. And by centralized institution, I'm talking about mega hospitals that are not really providing the services needed for the people it's supposed to serve. The global South has been struggling for centuries to fully first acknowledge and then confront the disconnection of the understanding of houses from the reality of a home. For example, structure and shapes of roundness and circles have cultural and symbolic meaning that over time have been subordinated to structures of rectangle and squares, which are also cultural, but normalized as global, to which all must aspire. Thus, we have houses, but people are living as strangers in spaces that should be their home. And it takes me to the second leg of this tool, your gate. A house is not a home. It only becomes a home when you imagine, construct, install, and own your own gate. I'm sure some of you may have heard the song by Luther Vandross titled "A House is Not a Home." The intent is similar, but I use these terms house and home here with a different question about the question. This distinction between a house and a home in global health work was one I have spent some time thinking about. In 1987, I was contracted by the United Nations AIDS program to lead and develop a communication framework on global HIV and AIDS. In 1989, we published a framework that we call a house-to-home framework. The framework that we developed provided a structure of a house framed in 5 walls and foundation. These 5 walls are government policy, 1 socioeconomic status, gender, spirituality, but all anchored in culture. We provided a frame and asked each country to make it into their home. Of course, making a house into a home for any country, we believe, starts with identity, which is to say, knowing who you are and what matters to you. And that takes me to the third leg. Do you know who you are? As the previous speaker has aptly mentioned, we've learned a lot from COVID-19. It's a lesson of connecting health to safety at home. We actually have, in collaboration with 13 other co-authors, we actually have a publication coming out in a week on communicating and messaging about COVID-19. In that publication, we focused on why it is important that we not only address individual risk mitigation, but also equally address, or if not more so, community risk that resulted from structural racism. Thus, the same communities that have the heaviest burden of this pandemic are the same that have had the heaviest burden of NCDs, not communicable diseases like diabetes, hypertension, asthma, to name just 3. By communities, we refer to communities in global spaces that are often populated with Black and brown bodies. We drew examples from the US, from Europe, from Brazil, South Africa, Nigeria, and Senegal. Our message is to design or re-emphasize one of the 2 priorities of Global Health Network that I mentioned earlier, which is to focus on the intersection and coexistence of NCDs, not communicable disease, and communicable disease. COVID-19 exists alongside non-communicable disease, not one or the other, but both. In the past decades in global health, we have focused on social determinants of health or advanced health equity. More recently, in the past few years, more and more scholars are calling for addressing the structural determinants of health, of which structural racism is a foundation. In so doing, we advance the notion that equity in health requires us to focus on the structures and systems that create and reinforce where people live, where they work, where they learn, play, eat, pray, meditate, or reflect. COVID-19 essentially reprioritized all this to say, if there is one place that matters more than others, it is the home. You could be housed in a shelter, ship or boats, as we're hearing, or in abusive houses. Is it a home? The question of home as a way to know who you are goes to issues of identity, which are expressed in language, spirituality, and values. Many young scholars from the global south often talk about decolonization, not just young scholars, seasoned scholars as well. You cannot decolonize without tackling global structural racism. When COVID is over, and it will be, because we will find a way to control it, we will still have to deal with structure and system that frame where and what kind of places people live, where and what type of work they do, where and what they eat, where and where they learn, and where and what they consider play, and finally, where and what it means to pray, meditate, or reflect. For me, therefore, the notion of home should go beyond erecting structure as a form of generosity and kindness, which are important and relevant, but insufficient. We must question the question that go back to each of the three legs of the stool to understand what does it mean to be at home, which is number one, who are the new historians we are training to answer the question of what a home means? And two, through what gate do they enter their understanding of home? And by that, we are thinking about theory, model, assumptions about what a home means. And finally, do they know what home means to them outside of what they do? And these are my reflections. And I do want to really, again, emphasize that the structures are one thing, and which are important, but how it becomes a home is really a part of the challenge we've been addressing in global health in using different languages. And it's my hope that through this network and those who are engaged and listening, that we begin to reimagine the notion of home, and as we also reimagine the solution to COVID-19.
Thank you very much, Collins. Thank you. You've given us a lot of things to think about, starting from the statement you made, we must question the question. And that's definitely a deep question that will require more than one conversation. So we are looking forward to interacting with you and people in your network as we continue to build this agenda for a more inclusive building performance discourse. I'm going to move on and invite our next speaker. His name is Mohamed Hilmi. He works with Interaction as the Senior Coordinator and Technical Specialist for Humanitarian Policy and Practice. Interaction is the largest alliance of international humanitarian NGOs and partners across the United States. Hilmi is a humanitarian shelter and reconstruction specialist who works to improve the collaboration, capacity, practice, and policies of stakeholders who respond to humanitarian disasters and crises. He's worked for several UN agencies and international NGOs in complex humanitarian emergencies and development programs. Hilmi has also responded to and managed emergencies such as conflict and famine in places such as Somalia, and also he's been involved in the post-genocide refugee crisis in Tanzania, Rwanda, among several other places. Ladies and gentlemen, please join me in handing over the podium to Hilmi.
Okay, can you guys hear me now? Yes, thank you. Thanks for Habtat and all the organizers for inviting interaction. Interaction is a coalition of 190 non-governmental organizations working in humanitarian and development around the world. So I won't go into details, but you have the website to check. Let me, it's not working, okay. Let me go through the presentation. I have about 5 or 6 points. First of all, I would like to highlight some of the humanitarian context, why and how housing impact communities, looking beyond the pandemic, and what we can do about the housing issues. So let me just highlight one country in among several dozen that really need humanitarian assistance, which is some of the largest needs in terms of housing. So this is Yemen. Yeah, you guys know, those who work in humanitarian, the severity of it. But for others, and to look at the numbers, so Yemen's population is about 30 million, 24.1 million people need housing assistance. So it is just one country, and in terms of housing, shelter, I will interchangeably use shelter and housing. We in humanitarian, because of the transitional temporary nature of the assistance, we use shelter and settlements versus housing as in a more permanent sense. So Yemen, nearly 5 million people need non-food items, household items. Nearly 3 million people need emergency shelter assistance, rentals, another 2 million. If you look at the numbers, it is completely mind-boggling. This is just one country that you are looking at. So I will stop there. I won't go into too much detail, but we will look at how and why housing is important. This is one of the report we at Interaction with the support of USAID did recently. You can find this report on our website. There's a link for it. So why the impact of humanitarian shelter and settlement assistance? This report went through Fiona Kelling, who did this as a consultant for us. This report went through nearly 190 research papers, reports, and others, and looked at how and what sectors and what degree housing affect people. Now, the table on the bottom left, housing and health are really strong evidence in terms of randomized control trials, peer review papers. But if you look at gender issues, which are weak, it is not. So you can look at this report later. Now, I know we know a lot about health now, or the importance of health because of COVID, but housing issues has been there before. It is there now. It is going to be there later. What we can do about it and why we should focus on it. Now, how does shelter impact gender and society? For example, one of the facts is women in India who own land are 8 times less likely to face domestic violence. If this is not important, I don't know what it is. We need secure tenure. We need focus on gender in terms of housing. It is not a one theme issue. And again, people in South Sudan, after receiving shelter assistance, 40% of them said they feel safer. Now, how does it affect social cohesion? 46% of people in Lebanon said housing assistance reduce community tensions and increase empathy and trust. So it is not just a place where you go to sleep or cook. It is more than that. again, 75% in Syria said it improved their relationship within the community. So I won't go into the detail. There are a lot of issues like this. In terms of resilience, in Pakistan, after improving the housing after earthquake, in future disasters, 50% of the house had less damage than the rest of the houses. So improving vulnerable, inadequate, unsafe houses, it's a key thing which people can continue. People can continue their lives after disasters. The businesses can function. There are many other improvements. Similarly, in Vietnam, houses improved. None of the houses improved damage for 10 years. So how it does help us from future disasters in terms of reducing vulnerability, building resilience, reducing cost of repairs, and people are more safer and self-reliant. Now, health, I won't go into details on COVID. We hear a lot. You might be fed up already, but housing, adequate housing, for example, MacArthur Foundation found impact children's developmental delays by age 2 already. And by age 6, it has profound health impacts. Now, so housing not only just providing somebody who is vulnerable now, it is for future generations as well. A lot of the housing people use not just the one family, people own the house, family homes for generations. So we are shaping how people feel safe, how people feel how have dignity, how people are healthy. And again, it has reduced a lot of diarrhea and other waterborne disease through this. Now, this is another fact I really like is in Nigeria, a very strong study said under 5 mortality rate reduced by 40%. This is a really strong impact why we should work with health professionals and others or others who are working in this area to ensure that housing is given the priority it needs. Similarly, people's disability over the lifetime reduced by 25%, and people visit doctors less, healthcare spending is less, so people have more saving and people can use that for education, other livelihoods. How does it affect livelihood? I won't go into details. It has increased food access to food, increased access to significantly for livelihood. World Bank study said 1 affordable housing give 5 direct jobs and 8 indirect jobs. So these are really strong evidence that why, especially at this moment, we should invest in housing. Affordable housing, because the economy is in tatters, infrastructure is in tatters, and investing in decent housing does revive economy much faster. So that is something to think about. Another important thing, mental health. People over 80, elderly, has a profound psychological impact, improved impact by staying in home, safe homes. It has reduced people's doctor's visit, reduced emotional stress, and increased happiness. People often, refugees and displaced people often attributed housing as one thing that made them feel safer and happier and stable. So these are some of the impact. You can see all of the other graphics in here. I won't stop here. So in this study, we have found a lot of evidence. You can read, it's about 60 pages of things. But we also want to question the research methodology and the evidence. So if something happening, positive thing happen in Nigeria, for example, is it applied to Philippines? Is it applied to Nepal? Or does the access to food or nutrition improvement, is it attributed to house, or is it attributed because people who have own house already have already economically better off, and they can have, you know. So we want to be much more stronger looking at evidence, not just anecdotal evidences. So this is one of the reason we need to work with academia, researchers, government sociologists and others to ensure that we have better data. The research currently going on in the housing sector is not as robust as like epidemiology or public health or others. So we really need to think how we can do this better, and Interaction is working on a roadmap for research. I would be happy to inform you later. Now, looking beyond pandemic, we know COVID increase the awareness of housing. We also know the SDG number 11, goal number 11, focus on housing. So is it all what we have? I think no. For example, improving poverty, the goal, one of the goal is through housing. Proportion of the indicator is proportion of people living in household with access to basic services. The other one is about decreasing death due to disasters, which we know by doing safer housing we can achieve. So these are some of the things how housing contribute to the SDGs. Not only that, if you look at all the other 9 things I put in here, if you read through, you would find evidence how housing directly contribute to outcome of SDGs. So I won't go into details, but that's your homework. Now, advocacy and action, what we can do. We know social development perspective in terms of SDGs, how important, and all the issues that I talked about before. No less than 12 UN and international conventions and declarations focus on right to housing in terms of non-discrimination, in terms of housing rights of women, children, indigenous people, refugees, migrants, and workers, and others. So we have that. Governments are to undertake steps by all appropriate means to provide housing for people. They have signed up to this. To the maximum of its available resources to achieve progressively minimum co-obligation of governments to recognize, respect, protect, and fulfill housing rights. What is happening in practice may be different. And housing, everybody had the right for legal, secure tenure, available services, and all the other things. I won't go into details. Now, what we can do about it? We have a humanitarian case. We have a huge need of humanitarian housing and other things. We have a moral case. We have a business case. Doing affordable housing is a good business model to revive the economy, to provide livelihood, provide improve health. Not only it improve just the people staying in house, it reduce government's healthcare costs. We have a legal case in terms of declarations and government's policies. So I think we have all the rationale why we should focus some of the efforts on housing and related issues. So that is what we have, and what we need is any initiative must be locally led. We as when I say like international organization, others, we address only 10 or 15% of the humanitarian needs. We, can't do everything. People build their own homes in Global South. Vast majority of houses are incrementally built. And we need to support them. So we need strong advocacy to the government and support communities doing their own thing. And instead of, like aid as building homes from another country. The other one is it should be multi-sectoral collaboration. There is no, we have known housing for a long time, the need and everything, people who work in housing. I think we need to come together from academia, from health science, from others, private sector, public. It is a win-win situation for everybody. So there is no reason we should still advocate for housing, but we should be able to work with others to achieve a common goal. Unlike some of you mentioned, unlike some of the other sectors like health, there's adequate data to communicate the needs, but I do not think we have quite a good data evidence to explain it better. I think we should invest a little bit more on that and work together. So that is why we are doing roadmap for research, but there are other issues. So I'll stop there, and if you have any question. Thank you. I'm going to stop sharing my screen, I think. Sorry. Thank you.
Thank you so much. Thank you, Hilmi. We appreciate having you share your experience and expertise with us. We have a few minutes for questions, and I'm going to take the first question, which was posed by DK from Penn State University. And this question is directed to Hilmi. Is there any difference in wellness outcomes for people or communities with self-build or auto-construction components versus people who receive housing and shelter that is delivered by agencies or governments?
I don't know the exact outcome of this. I am not sure to answer you. To be fact, whether you are asking when people build their own home versus somebody else, how government or agencies build their home, is there a difference in welcome? I think oftentimes as a humanitarian, we try to rely on communities doing their own homes, supporting them. As far as I know, I mean, there's others who import containers which we don't like, containers or pre-built stuff. We encourage people building their own home using local material, using local technology. However, it is not universal in many cases. But one thing we know is that when people, after a disaster, refugees, people engage in productive work, give them self-esteem, give them income, give them something productive to do, they feel better in terms of that, in terms of trauma and other things. So it is true when people work on their own in a humanitarian context, they have a positive outcome. Yeah, so that's all I can say. I'm not sure if it is the same in a more of a social context when people build their own homes. I would assume from my personal experience, when my family built our home, not we building, but at least to manage and doing individually, I think you feel proud of yourself. That's, oh, we have done this, you know what I mean? So
yeah. Yes, thank you. I'm actually going to invite Collins to also weigh in, and that's because from what I learned about the work that you did with HIV/AIDS, you did have some interactions with people who are in the lower social economic status. Did you learn some experiences about, what works when people are given houses or not given houses, or when people are given a chance to participate in building the houses? Please share with us your experience, Collins.
Yeah, thanks. The experience in that case, if we were to look at South Africa, for example, where after years of apartheid, so many black and brown population that is defined in blacks in South Africa is African, colored, and India. But particularly the African population was congregated in small spaces that are called informal settlements. So at the height of HIV AIDS in South Africa, my collaborator, Olive Shisana, who was the director for research and subsequently president of Human Science Research Council, did a nationwide study, which was the first of its kind, to rather than using predictive modeling of pregnant women who had HIV, but actually going house to house to look at the risk and risk profile of family. That is when it became very clear that the housing, the informal settlement that have these small spaces where people live were the places that had the highest burden of HIV and AIDS, compared to other Africans who may have been in rural area but have spaces. And also so you have the combination of urbanization where people congregated in Khayelitsha, for example, just outside Cape Town, a sprawl of slum in a sense because of economic deprivation. So socioeconomic at that level was basically a failure of the state, in which case it was planned to be that way. And then the inability of individuals to have resources to support themselves. The other point about housing, outside of just socioeconomic, I grew up in Nigeria. I grew up in the village. We grew up, and I know the way the houses were structured, where you cook at the back of the house. But the ventilation system and how mindful we were of ventilation in the village, it was very different from what you find in the city, even though the structure will look more appealing because the structure of the villages were responding to those cultural needs and value. Where you wake up, you are supposed to sweep your surroundings. They are just very strict value you grew up with in terms of hygiene and all of that. You go into a city where even when you have the resources to rent a space, the ventilation just wasn't there. People dying of using gas stove, for example. And so the structure of socioeconomic, in that case, it wasn't the case that the lower money, the less you have, the poorer health outcome. It became a question of what the space and locality was. If you were in an urban area, you did not have the luxury or even the encouragement to transfer the knowledge that you learn in the village about ventilating house to the city because the structure wasn't encouraging of it. And there are so many other things. And then you add on to that, you go to school, you are asked to only speak English, and you were actually punished for speaking your language. And this translates to the devaluation of everything that was framed by the culture that really mattered at improving health. So those things were left to stagnate, to not ever evolve. And today when people make comparison, it's like comparing a system that has achieved a PhD to a system that has been left to stay at the primary school level. And you are comparing two of them. You can't make comparison, whether it's in spirituality, whether it's in the language of communication, or in housing as we knew it. So it has to be a total reimagining of what it means to be a home. What can you draw from what was there to add to what we are learning? And finally, I have a very good friend at University of Ibadan who actually was former dean of graduate school. When he was building a house in Ibadan, he told me how he actually burnt a house of, we call it mud house, but he used burnt brick that he found that through his research in terms of ventilation and the cooling and keeping the same temperature was far superior. So when he tries to tell his colleagues and others to use that, of course, the model of what came with cement and other structure is what was normalized, not that which, even though with his research and degree, he's demonstrated that in building his house, it was better to use the material that were there because of the health benefits that accrue from it. So there are a number of ways that we can look at this and benefit from what is there.
Thank you. Thank you so much, Collins. You've given us quite a few things there to think about, things that sometimes get overlooked, like the value of what is indigenous to the context in terms of both the choice of the material and also the spatial layout, the things that have already worked there over hundreds and hundreds of years. We can learn from them and we'll get better outcomes. We have time for one question, and I will pose a question to Stacey. What have been the policies that were put forward to ensure right housing in, I don't know if this is for you, but I'll read the question. It says, for Stacey, what are the policies that have been put forward to ensure the right to housing in COVID-19? What is the role of the academy, the civil society, and NGO in this? What policies, I'll paraphrase, I think you've got it actually, so go on.
Yeah, thank you, Esther. It's a wonderful set of questions. So the first question on what have been some of the policies, of course, those will differ depending on what community, country one is in. I can point to one resource that I find very valuable and very intriguing. It comes out of Princeton University. It's focused on the 50 states in the United States. The link is evictionlab.org. And the Eviction Lab is essentially tracing different policies that have been put forward by each of the 50 states in the United States using a variety of indicators. It's focused on people who rent in the kinds of policy considerations that the different states are enacting. And it rates the states by how well they're doing with renters, right? Massachusetts is the state that is rated the most favorably. Unfortunately, the state that I find myself sitting in right now has a little bit of work to do, but that resource, evictionlab.org out of Princeton University, is an interesting one in the US and from the policy perspective. In terms of what the role of academia, civil society, NGOs, and private sector can do, I think all of us today, Hilmi, Collins, and I have really, I think, called on all of us to work together. And that's something that Esther, Rebecca, are very dedicated to as well. These are some initial thoughts. I'll start with civil society, which is the heart and soul of communities, right, of local communities, and doing the very difficult work of trying to navigate civil society challenges at local and other sorts of levels, and influence policy on behalf of those individuals. The experiential knowledge and the sets of experience that civil society brings to the plight, right, of people in housing is so very important. And civil society always has to be at the table, in my opinion, for policy to stand a chance of being very effective. And of course, Habitat for Humanity, you see someone on the screen, Rebecca Ochong, who's dedicated her life to that very mission. In terms of academia, of course, institutions like Penn State, Georgia State, where Collins is, and then also Purdue are, we're dedicated to working with the civil society sector, with private sector and with everyday citizens. And I think, academia, of course, has the research kind of value add, but then too, we also have a cadre of young people, right, who stand ready to work with civil society and with the private sector. And then, just really quickly on the private sector, right, that's in Purdue's DNA. We believe really strongly, as I know Penn State does in Georgia State, in involving private sector. And they bring everything from the potential to sustain initiatives to employment to bringing their innovative technologies and systems and practices to bear on social problems. And I think COVID has really also sparked a real interest in many in the private sector to want to contribute, and certainly in the area of housing. So those are my quick responses to a very, very good question and a very complex set of questions.
Thank you so much. And we've actually run out of time, but I think it was important for us to get you to share your perspective because, as I stated earlier, we are trying to broaden the discourse in building performance. And the three panelists we've had, you're part of the breadth, you're bringing your experience and expertise into helping us broaden the discussion. So we will continue with the question and answer using the social media handle that Enid is going to post in the chat room. But I'm going to hand over to Rebecca so that she can do the closing remarks. Thank you, everyone.
Thank you very much, Esther. Thank you, everyone, for joining us today for this very, I think, very informative and very vibrant discussions. I think there were a lot of perspectives we got from Stacey, from the policy angle, communications and policy angle, and really bringing out some of the issues that we already talked about, how the most vulnerable are the ones who we continue to see are most impacted, and also some of the systemic issues that needs to be addressed. And I think also listening to Collins, tackling this from a health perspective, and just drawing lessons also from previous work that he has done, for example, on the HIV/AIDS and so on, and just seeing how really where you live sometimes can really determine, how more prone or less prone you are to some of these health challenges. And then, of course, Hilmi also bringing to us in terms of the perspectives from a humanitarian context, from looking at the kind of work that they do in some of the the areas that are going through a lot of disasters, or there's conflict and etc. And really, so I think there's a lot of rich discussions that went around today. So I think I just want to encourage you, because this is a second part of the webinar. We're going to have another one in a month's time. So we look forward to having all of you join us again next month, round about, I think we'll communicate the dates later. We'll have it sometime in July. Oh yeah, that's going to be July 15th next month. And this one will focus on communication, gender, and safe homes. So we look forward to having you join us for that. So.